All right. Now, many of you have been asking me about the auricular head and how I use it for doing things transnasal and in the ear. So, many times when I'm treating things such as stroke, dyslexia, all sorts of different neurological things in the brain, we like to come in, we like to use this particular probe. Now, you can use it on acupuncture points, you can use it on auricular points. One of the ways that I use it is I usually take this little cover from Welch Allen and I place it on top of it just to protect it. If not, you can wipe it down. My protocol, depending on what I'm doing, we've been doing headaches and migraines here, is that sometimes I'll come intranasal and then I'll come through the ear, especially if she had TMJ. She had a little bit more of a condyle here that didn't cause any popping or clicking in the jaw yet, but this would be a time to do it, or if they had tinnitus or tinnitus, okay? We'd actually come in through the ear. So I just wanted to show you how I use that. So I take this little plastic piece from Welch Allen, and usually the protocol is I usually do probably 1.5 to 3 minutes per side maximum for me. I have it on maximum power. If I was treating a child or someone that was smaller, I'd probably turn the power down to 1/3 or to 1/2. Now, you can't do any damage here, but again, it's trying to get a good potentiation, and coming in directly helps us to bypass and not have to come transcranially, where we can come up into the midbrain guards. So we were treating headaches and migraines. I have the cap on it, and what I do is I turn it on and let the heat sort of build up, or the power build up, okay? So sometimes if you turn it on, a little heat might build up in the tip. So I let it go for a second because I don't want them to get an instant blast of what feels like some heat or something that might make them uncomfortable. So I let that energy dissipate a little bit, or I turn it back down depending. She had a little bit of sensitivity here in the trap, so I'm actually going to turn the power down by just hitting the button here to about 50%, okay? So just depending where we're at. You can see we have frequency specific there. They're even more enlightened as we have the tip on that you may not see without the tip having the regular head on. So I'm going to come in here and I'm going to sit down usually where it's easier. I have better power and control. Close your eyes. Now, she has her eyes closed. If they were afraid or if there was any fear, you could have them wear the glasses. How does that feel?
A little ticklish.
A little ticklish, okay. Now, she shouldn't feel any warmth at all. So again, I'm going to go for about 1.5 minutes on each side, so a total of 3 minutes. Now, I have a stroke patient, and I'm doing about 3 minutes per side with him, but I worked my way up. So, intranasal is really great. Again, excuse me, I like using the combination of red and infrared, or if you had the Revy, combination of the red and the violet. Some people prefer to use just red or infrared. If that's the case, you can do whatever you'd like to do. Again, I'm giving you a stepping off point, telling you what I do. So we've done 1.5 minutes there. I'm going to come to the other nostril. I'm going to really come in, make sure that we're there and protect it. And again, this is going to be for about 1.5 minutes. So I have mine set, I don't know if you can hear it, but you can hear it sort of vibrate and beep. And so I know every minute something is, I can change it, or it gives me an idea how long I'm doing things. So we're going to have it beep one more time. That'll be about 1 minute and 10 seconds, and then I'm going to hold it for another 20 seconds. This is phenomenal for a lot of brain fog, ADD, dyslexia. Even sometimes I do this with people with POTS, right? So dysautonomias. Again, there's so many different things. We have a lot of practitioners that use it for autism. I do this for PANDA, anything that has inflammation of the brain fog. This can be a great accessory for that. All right? So those are the places we're going to go. I'm going to hold it just a little bit longer, and then I'm going to show it because she's doing good there. But you can see it illuminate the whole nose. This is really pretty cool. I'm going to come back out. Now, for tinnitus, you can hear it beep again. I can come directly here into the ear canal, and I don't have to come into the ear very far, right? So again, this is really good. Many times if you had tinnitus here as well, I'd be doing some different sounds as well as the different things here. And then I could take another laser and laser the temporal lobe. Many times with TMJ, the TMJ gets inflamed, right? Then that inflammation causes the nerve that sits directly behind that ear canal, sits right behind that TMJ, to get inflamed. When it gets inflamed, you get an aberrant frequency of firing through that nerve to the temporal lobe. When you do this over long periods of time, it's really, really hard to get back. It really is, because nerves, once they regenerate, really it's hard to bring them back because it's very slow, and now it's somewhere in the brain, which is really tougher for us. But this is one of the tools you can do. But I would like the laser here and the temporal lobe. I can use different tuning forks. I can use a whole lot of different things while I'm lasering in conjunction to try to get that frequency of firing to the temporal lobe. Remember, your brain only knows a frequency of firing which it's learned. It's not like there's a tuba area of the temporal hearing lobe. There's not a violin area, and although yours is probably pretty well pronounced, right? There's not a drum area. Again, it's only a frequency of firing of which the brain interprets based upon knowledge and repetition. All right? So that's how I like to use the probe. It's wonderful too for using it on acupuncture points like the large intestine. I can come into here. I can come into the B and E points. I can do bladder, gallbladder, stomach, triple warmer. I can use it in different areas. So again, it's a great tool and a great adjunct. But anyone that's doing a lot of brain work, I highly recommend it, and that's how I use it. You can use it in multiple different ways. I'm just, again, trying to give you a stepping off point. So, thank you.